My name is Erin Ricketts, and I will be discussing the efficacy and safety of non-surgical sterilization in dogs and cats. Every minute, 50 dogs and cats are born in the United States. These animals are reproducing, but at a rate much faster than they can be adopted or taken in. 6 to 8 million cats and dogs enter shelters every year, which does not include the millions that wander as strays. While idealistically, these populations should be controlled by responsible breeders, the problem is compounded by the large numbers of animals that are not spayed or neutered, a big portion of which includes strays and free-roaming animals that continue to procreate, creating offspring that are typically of inferior health due to malnutrition and lack of proper care, which render them susceptible to a wide range of diseases that then pose a potential risk to the human population. As a responsible pet owner, one's duty is to make sure to sterilize one's pet to prevent these accidental breedings. Additionally, studies have shown there are other benefits to a lack of reproductive organs, including a decrease in certain cancers or illnesses as dogs and cats begin to reach geriatric ages. Unfortunately, in order to remain as humane as possible, sterilization techniques in small animals are surgical procedures done under anesthesia, therefore not inexpensive. Thus, it is impractical and costly for animal control personnel to attempt to spay and neuter all stray animals. Luckily, there have been advancements and recent success in chemical sterilization. There are various types and methods of chemical sterilization, including direct injections into the testes, hormonal implants, and contraceptive vaccines. The first procedure is chemical sterilization of males via zinc-based solutions. This technique involves direct injection into the testes, destroying sperm and sperm-producing capabilities. There have been a variety of solutions proposed and tested over the years, but a type of zinc gluconate seems to be the most effective. Back in 1993, Fahim et al. Conducted a study using zinc arginine, the results of which revealed destruction of the rete testes, which is part of the pathway traveled by sperm as it develops, thus resulting in a lack of sperm further down in the epididymis. It was released under the name Nutrasol, but multiple issues led to its recall shortly after approval. The massive side effect was scrotal ulcers, which were deemed the result of improper injection technique. The product was further researched and the procedure perfected, leading to the study done by Oliveira et al. The results of this study were positive, with the dogs outwardly unaffected by the procedure, no irritation caused by the injection, nor pain or sensitivity. Most importantly, it showed inability for the dogs to produce sperm, with 80% of dogs with no sperm in their ejaculate, while the others had very few live but defective sperm. Lastly, it was observed that the process was irreversible. Based on evidence from prior studies done by Oliveira et al., their results this time were consistent with those previously. It appeared that because of the damage to the Sertoli cells incurred by the injection, in addition to all the inflammation, resulted in the conclusion that the dog's own immune system may have permanently destroyed the seminiferous epithelium of the testes, resulting in sterility. All of these findings deemed chemical sterilization via testicular injection as a viable option. The second type of chemical sterilization is through the use of contraceptive drugs. These would be a chemical option for males and females, and it would be available for both dogs and cats. Using an understanding of the hormone cascade involved in an animal's estrous cycle, this procedure would use chemicals similar to the drugs used in livestock breeding programs to synchronize estrus in the females, but obviously with the opposite intent. The administration of drugs that stimulate the release of gonadotrophin-releasing hormone, or agonists, can be used to reduce the release of FSH and LH, whose surges control ovulation and follicular growth in the female, and tonic pulses control testosterone and sperm development in the male, effectively disrupting reproductive abilities. In order for them to work, the hypothalamus needs extended exposure to this agonist. So the drug would be given in the form of an implant. In a study done by Romagnoli et al., the semen quality of dogs was evaluated after use of a GnRH agonist. The dogs were given an implant, and then the dog's semen and blood quality was checked and observed over several months. The results of their research showed success. with the eventual reduction in sperm numbers, but it did not affect the morphology of the sperm, just the amount. Since GnRH agonists would be given as implants that are only effective as long as they're in the animal's system, this method of contraception is not permanent. Also, based on the study above, it was observed that it took at least a few weeks or so to reach total infertility. Both of these disadvantages make GnRH agonists impractical for use by shelters or animal control centers. Alternatively, rather than overexposure and desensitization of the receptors, drugs could also be used to inhibit GnRH release, restricting LH and FSH release. This would be done through antagonists like acetylene, which binds to GnRH receptors, blocking GnRH from the body. Studies done on male dogs injected with acetylene showed reductions in volume of ejaculate as well as sperm concentration and sperm motility. Female dogs also showed some success. Because of the action of antagonists, their response is much faster than that of agonists. Results are almost immediate. LH and testosterone levels decreased and were held depressed until a rebound almost a month later. This increase in hormones would signal the administration of another dose of the antagonist. Obviously, much like the agonists, this procedure is lacking in the ability to endure. Lastly, there's a chemical that can be injected that kills primordial and primary follicles successfully in mice and rats. It is called 4-vinyl-cyclohexene diapoxide, VCD, and it is formed in the production of tires, flame retardants, insecticides, plasticizers, and antioxidants. The fact that it targets the ovarian follicles means it would obviously strictly be used in females. While looking for ways to cause menopause in female mice, which continually produce oocytes, Dr. Meyer discovered that 4-vinyl-cyclohexene diapoxide, or chemspay as it will be called, worked orally or via injection to reduce the number of eggs in the female dog. Her studies showed successful infertility in the dogs tested. These studies have only been done very recently and are in the early stages of development. Moreover, the researchers have little understanding of the long-term and possible harmful effects and are therefore several years from actual market release. The final method of chemical castration would be via contraceptive vaccines. Vaccines trigger the immune system to release antibodies that will destroy the foreign invader, as well as produce memory cells to equip the body with a stronger, faster response should the same infection enter the body. In this case, the vaccine would result in the formation of antibodies that would target the reproductive system. Multiple targets have been studied, specifically GnRH and the zona pellucida. GnRH vaccines induce antibodies that will inhibit binding of GnRH to its receptors. Vargas Pino et al. Studied the effects of GnRH vaccine Gonacon in a group of female dogs in Mexico. Unfortunately, while GnRH antibody production was high and progesterone was reduced, there were many other unexpected side effects. Many of the dogs had degeneration of their muscle where the vaccine was given, and there was a possibility of damage to the liver and kidneys. The last type of vaccine does not target an endocrine hormone, but rather the zona pellucida, whose protection is essential leading up to and following fertilization. It's a defense layer surrounding the oocyte that sperm must penetrate in order to actually fertilize the egg. Blocking the binding of the sperm to the zona pellucida would prevent pregnancy, but only that. There's been great success in the wildlife field using the zona pellucida vaccine. They have lucratively controlled populations of wild horses, deer, koalas, and seals, with the first two having no detrimental health effects. While there were some difficulties with dogs, it was the result of different layers of the glycoproteins that make up the zona pellucida, with only specific layers actually resulting in infertility when targeted. Vaccines targeting ZP3 have effectively blocked pregnancy in female dogs, but multiple vaccines are necessary for completeness. With further research, chemical sterilization is definitely the future of spaying and neutering. It is evident that there is still a lot of work to be done, and these products realistically won't be available for many years. Sadly, many of them failed to meet the irreversibility criteria, but all of them were highly effective in the populations treated. Furthermore, those products whose effects were not permanent are more realistic for dog owners rather than for dealing with large populations of stray and homeless animals. But these methods, when they are approved, will be far cheaper due to the fact that spaying and neutering will no longer be a surgical procedure. Spaying and neutering will become an outpatient procedure, which means that pets will no longer have to stay for an extensive period of time at the veterinarian's office, and will no longer have to deal with the side effects and disorientation associated with anesthesia. Procedures like direct injection into the testes only require mild sedation and are therefore less stressful for both the pet owners and the pets themselves. Pet owners will appreciate the ease, simplicity, and inexpensive alternative, and would assumedly be more willing to care responsibly for their pets. The pets will reap the benefits of a faster method that is also more humane and has little to no recovery time. Lastly, animal control will have an inexpensive yet humane alternative for dealing with the large amounts of overpopulation in dogs and cats. The procedures themselves will be much cheaper, but also animals can be turned over at a faster rate due to the outpatient nature of the procedure, thus reducing costs of housing animals while they recuperate. While there will always be unwanted animals or strays, if there is a quick way to sterilize these populations, a significant reduction will be apparent. And ultimately, this will allow greater protection for the human population and the spread of zoonotic diseases.